right. Good morning, guys. I'm Dr. Jenny, user physical therapist and Dr. Physical Therapy, board certified clinical specialist in geriatrics and certified expert in exercise aging adults. All right. So today, for the Balance and Fall support group in our podcast, we always interviewed great entrepreneurs, academicians, therapists that are really making great contributions to our colleagues and also to our clients. Today, we have the opportunity to have Dr. JJ Mowder-Tinney, and we can call her JJ for today, only for today.
Yes, please. No, that's okay.
Yeah, no.
I'm good.
All right. So thank you so much, JJ, for this opportunity. We are so honored for your time. So JJ is a physical therapist academician, and she is based in Rochester, New York. She used to be in Colorado, but she's now here in East Coast, and she'll tell us more about her today. All right, guys. Welcome, Dr. JJ Mowder-Tinney, and let's call her JJ. All right.
Yes, a lot easier.
Mm-hmm.
Good morning. Thank you so much for having me. It was really nice of you to have me on. I'm excited to be here.
Mm-hmm. So tell us more about yourself, JJ. I believe you're a physical therapist, and also what are you doing right now? Are you teaching, or you're doing more still a clinic?
So it seems I'm busy. I taught at Nazareth College in the physical therapy department for 15 years, and I just left there full time. I'm just doing adjunct in the clinic because they have a pro bono clinic that I helped start many years ago as part of my neuro course. So I teach all the neuro and the geriatric content.
Yes.
And so I just left there full time, and I'm transitioning to South College down in Knoxville, Tennessee. So I'll be doing the hybrid program and doing the online and then going down for the immersive labs because I wanted some more excitement. I needed to learn some more. So wanted to change, and I travel a lot. So every weekend for the most part. This is the longest I've been home during this pandemic. And so rescheduled, but I do a lot of continuing ed in different ways because my love is really trying to translate the research into practice, and so helping therapists. So actually, my husband figured out I'm doing a few jobs right now. So between that and then my continuing ed in for different companies, and then a new membership program that we started. I started with Erin and Claire out in California, NeuroSpark Network, which we can talk about later.
Wow, that's amazing. So you're saying you're a neuro clinical specialist, right? And you're also teaching us more on geriatrics. And why do you think you're more focused more on therapy? So what influenced you to go in this field, like healthcare, clinicians, and teaching, of course?
Well, it's so funny. My mom was a physical therapist and owned a private practice. So I grew up in her clinic, the youngest of 5, but the only one to go actually into healthcare. And so I love that, but she was orthopedic, and all my clinicals were neuro, and I just loved it. And so I worked at University of Rochester for about a decade. And I did most of the time, I did a lot of different units, but I spent a long time on rehab. And I just kept going to course after course, NDT training, going, to this course and this course, there's just so many different things to learn. So my areas are, from a neuro perspective, is stroke, spinal cord injury, and Parkinson's. And then the big picture of geriatrics. The reason I love them so much, and I think we are probably very similar in this, in that there's no cookbook approach. Yes. Every person is so specific and individual, and you design the intervention based off what's salient to them, but based off how they present in your evaluation and assessment. And then you can tweak this to make that emphasis more. And then you'll learn a cool trick from another therapist who said, oh, I adjusted it this way and moved the TheraBand here. And then get more repetitions, and then figure out another way to make it harder. And so it's always this, it's never ever the same, and it shouldn't be. And it's always, I've learned more treatment ideas from my patients by just listening to them, hearing about what they want to be able to do so badly when they get home, and or what they're worried about, and turning that into an intervention and just making such an impact. I mean, I am so grateful. It's just it's so amazing to be able to work with such incredible people.
Yes, I believe that. Especially, thank you for joining us in the geriatric rehab summit. And then I said,
Oh, yeah.
we have wonderful speakers. And then also, I agree with you that we're learning from different therapists, their tools, their skills, and it is like we're trying to be outside the box, and we're treating it holistically. It's not like we're physical therapists. We will not touch the other things, the uppers, because here,
Right.
OT upper and then
Yeah.
physical therapist lower. So I said to my clients, okay, you don't have an OT today. We'll treat you holistically. Yeah, it's possible. And then it's really, as you've said, it is like one case is different than the other. So tell us more about one of your challenging clients. Either it's a Parkinson's that you really have a great progress and very challenging, stroke or things like that.
Well, I mean, I think, gosh, there's just so many, because it's a pro bono clinic, I can think back in the day when I was at University of Rochester, and, that was like when I worked on the burn unit. You see progressions. I can think about my patients when I was on the acute inpatient rehab, especially high-level spinal cord patients.
Yes.
Or, spinal cord patients who had lots of potential, but who had other fractures, and then you're limited. So you want to keep them moving forward and set them up for success, but you're limited. And then I think about, when I was in our clinic for 15 years, and they're more outpatient, and seeing people who've been discharged from physical therapists, and they're pretty much said, this is as good as you can get. And then they come into us just to kind of maintain. And I'm like, oh gosh, no, like, we can push you harder. We can, we can get you off that device if it was safe, or at least we can increase your distance. We can increase your cardio. And just, I think that piece, so I can't think of just one, because so many people just start popping into my head, but I think all of them came down to a consistent, challenging them harder. And it was amazing. I'll buy stuff like, I bought a scooter once, and I was like, I'm crazy. Like, I can't use that. And it took me like 4 weeks to use it, because I had a vision in my head, and then I got it. And once I got it, I'm like, oh, my husband's like, what'd you buy now? Because I would always buy it myself, because I wasn't sure if it'd work. And then finally I was like, okay, I'm going to try it. And then all of a sudden it was like too easy even. But it was great. And we were able to add more things. And I mean, even from students giving you ideas, like I loved your summit.
Thank you so much.
It was, first of all, it was just creative, and I appreciate you putting together something unique. And it pulled in people, so then I started thinking about the activator poles. So I bought a pair of those, and, I took that course, and I was like, okay, I could see where I could use that piece. And then, learning about, you could put a little book together. You asked about a book, and I was like, no, but I kind of now want to put something together with different focused treatment ideas, or, so it just kind of took you and gave you just little snippets. And because just one thing doesn't work for everybody. And I should cameo that by saying, other than the challenge part, other than the intensity, and upping it. And I'm just thrilled when I don't think they're going to do better, even when they're low level. And then, instead of correcting them when they fall over, I let them kind of fall a little bit over as far as I feel comfortable. That's probably I'm the limiter, because I'm so trained, and I train the students. You got to correct them. Like, you don't let them fall. That's bad. But you have to let them err, and you have to let their brain try to figure it out. And then you have to push them some more, and really feeling comfortable with that. I think that I'm really good at it. And then someone will show me that, no, I could have done even more. And I'm like, son of a gun. You're right. I could have done more. So
you can always push them more.
Consistent thing. Yep.
Yeah, so
really
you're
exciting.
very comfortable doing that. You're trying to challenge them. At the same time, they see their capability. I always explain them that if you didn't do this, you don't know if you can do it. And we need to push you, knowing that you're with a clinician right now. You will not do this at home, because these are the professionals around you. Let's do everything here, so they will be more comfortable.
And I think you bring up an excellent point, because I think for me, when I reflect back, some of it was, especially in acute inpatient rehab, or, we had a guy who he's older, he's in a wheelchair. He wanted to do a flight of stairs in a wheelie. And, everybody was like, no, don't teach him how. And I'm thinking, oh, well, he's going to probably do it on his own because he was pretty at risk. That's how he got in this wheelchair. And so we worked really hard, and I taught everybody how to do it. And then we did it. And then at the end, he came up to me and he said, oh, no, I'm never doing that. No more than 2 steps at a time. And I said, I would agree wholeheartedly. But before, I wouldn't have addressed it, I think. In times I didn't address it because for 2 reasons. One, I was afraid they'd go do it on their own.
Oh, good point.
And there are people who are like that, but I think that we shouldn't make that assumption that I can't challenge them here because they may go try to do that. Because I just haven't found that to be the case. I mean, there's always exceptions, and then just that aspect of showing them what they're capable of doing, and showing them they're able to do more than they thought. But I'm afraid that if I try this and they fail, they're gonna feel bad, and I'm gonna feel bad. And that hasn't been the case either. Even when it doesn't work, I go, oh, that told me this. Okay, I was wrong. Wasn't that we need to focus on? It was this. And as long as we're working together, they love the fact that I'm trying, that I'm doing something that other people weren't willing to do. And I was believing in them, no matter, even if that didn't work out. And, I made a lot of assumptions in my younger years. I still do, but I'm trying to work out of it. I made a lot of assumptions that, they're going to be upset or they're going to try to do this on their own instead of like, this is the best thing that I can do for them as a treatment right now. And everything is, I just have to trust that everything else is going to work out.
Yeah, I love that. We really need to involve them because the first thing we're asking is, what's your goal, right? What's your goal? Let's focus about you. And then we are just an instrument that for them to reach that. But the fact that they're being involved in the process of their like the plan of care. So when they are involved, the compliance will be better. And it will be speed. Oh, she asked me what to do. They're just not bossing me. Oh, this therapist is different. She's not ordering. She's asking me what to want. So we will be more on like a team. It's not like a boss and then an employee during that. So that's a different approach too. And they love that, the clients. So that's for the clients.
Right. And the research supports that, right? The research says it allows you to have better outcomes. And I think that, when I first came out of school, I thought I was supposed to show them how smart I was. And you know what I mean? Like, I'm supposed to show them that I know what I'm talking about because you always wonder, do I know what I'm talking about? And after the first year, I realized, I'm not wired that way. So then, and they knew it didn't feel right, and they knew that you weren't working with them. And yes, I was asking them, what's your goal, to check off my box. So our accreditation people knew that I asked the patient what their goal was, but was I really listening to them talking about what their goal was? And even if I couldn't do that, once a guy told me, he goes, oh, you're going to think I'm crazy. I said, what do you really, really miss like doing? And he said, oh, you're going to think I'm crazy, but he used to skate. He used to hockey skate.
Wow.
And I was like, okay. So, we got the 2 pillowcases and put it over his feet. And we started to get him because we're trying to get his foot to push through because he had a stroke, and we're trying to get the weight shifting. And then we added, someone brought in a hockey stick. And so we could add the trunk rotation. We added the visual tracking with the puck. And he knew he wasn't going to go out and go skating, but man, did he have fun, and even dancing. I got all of my goals accomplished and challenged the heart rate. And we had a great time. And he was teaching us spins, and he said, that's the first time I've forgotten I've had a stroke in 4 years.
Wow.
Because he was back in his place, like his place of joy. So even if it's a part of their joy, and I do a lot of music and sometimes I had this little 93-year-old, my 93-year-old, and he came in and he's Italian, and I was like, okay, so let's do music. I'm sure he loves to dance. He's like, I hate to dance. And I was like, darn it. I go, can't you love to dance just for today? And he's like, mm-mm. And I was like, all right, then we change it.
Next.
I don't know how to dance. I always have them teach me, but for him, I was like so sure, and then it's like, nope, denied.
Yeah, that's a good point. We always assumed, right? As you said, right? Oh, this is Italian. Oh, I'm sure they love to dance. It's a culture base, but we personally, it's a mistake that he's not really more on the music person. But we always, cultural diversity, we learned that as well during the summit. But we always think that they are not all Parkinson's like this, not all stroke will be like this. So that will be more on personalized approach as well. So that's for the clients. So do you have any tips for us clinicians of all the courses that you have? I believe you have NDT, you have also certified exercise in aging adults, the power. I believe the PWR for Parkinson's wellness recovery is one also. You love that too. Do you have any advice for us clinicians, especially for our balance and fall support group?
Yeah, and I think, although the power course is Parkinson's wellness and recovery, although it's, focused with Parkinson's, I have used those techniques with all of my patient diagnoses. And I think that the reason that I find it so beneficial is because of the challenge component, because of, you're teaching them bigger emotions, you're teaching them quicker emotions, in some respects, but you're constantly progressing these movements and moving them in all different ways. And when you think about balance, and my area of love and my area of research is reactive balance. And really, that's what a few years ago, and that's what I presented at CSM, was reactive stepping and, getting not only the anticipatory, but the reactive components and challenging your patients continually higher with that. And I think that there's aspects in power when they use the TRX and when they use these other things that, I pulled those in when I was trying to find, ways that you could realistically implement, the stepping reactions, and trying to take your patients, no matter their level, whether it's back at low level and you're working on visual tracking, and saccades, and trying to get them set up to be successful when they get to this ability to start moving around. But we need to set them up to prevent themselves from falling. And so I think that the power component helps with that. The reason I like NDT, and I know that's a big power discussion for lots of people, but it's the normal movement. It's what taught me. I took so many courses and neuro-IFRA courses, but it helped me analyze movement. And until I can analyze my patient and see that when they go to do this motion, these muscles aren't turning on at the right time, or they don't have any hip stabilizers to be able to turn, and we turn so many times a day, So, being able to analyze the movement, that's what our profession is as therapists. We analyze movement all the time.
Movement expert.
And so, yeah, thank you. That's the word I was looking for. But we're movement experts, yeah. And so, I think that's why I say that. And I think that should be a foundation of everything we do, is why are they losing their balance? Why do they need to walk with a walker? Why can they only walk 100 feet? Because sometimes I'm stopping them before they do that. Sometimes I'm not trialing them without the walker. I'm assuming, well, I need to get them safe with the walker. Well, but why do they need it? And am I addressing that? So I'm not answering your question exactly, because I don't know that I have a course that puts all those pieces together. But I think no matter what course you go to in the back of your head, be thinking about the why part and what are you going to take from this course? Whenever I go, I like to take at least 2 things, hopefully, that I can go mess around with, ask other therapists about, and then try to make it realistic, and then go tell as many therapists as I can about it. And then they'll say, oh, I tried this. And I go tell more people. I mean, I consider my goal just the bridge. I want to translate as much knowledge as possible. And I think that you go back to just constantly reassessing that why. I don't know. I get all excited. Sorry.
Yeah, me
it's
too.
really fun to try to do that, and I think that's why we love balance and we love neuro and we love our aging adults.
Yes.
Because they're so, just awesome people.
I super agree with that. This neuro and geriatric components we have, it's really broad, and I'm very fortunate enough to meet different clinicians that have the same niche, that same love for aging adults, older adults, and then it makes you you keep learning, you love to learn, and then at the end of the course, let's apply this. That's amazing. It's another way you keep learning, and then as if you're newly graduate, I apply it. But knowing that you're already a clinician for more than 15 years, this another thing that you learn from another clinicians, and they are just new. So that's really amazing, and really I like what in our group presenting, learning from different clinicians like you, different to the team, so that's really good. That's really good.
And just to clarify, I was 15 years at NAS, so I'm 25 years out. So not to make anyone sad, but like I am still learning all the time, and from amazing therapists who, a great PTA, Alyssa. She hasn't been out hardly at all, and she was like, "Oh, Jay, I tried this new thing," and then I'm like, "Oh my gosh, like that's a great idea!" Like, you can collect ideas from so many people. Then it's, being able to realize that there is no answer. Because if someone tells you there is, I'm suspicious, but there is no one answer that fits all these people, but that you're reevaluating, and then you're taking, oh, you know what? I remember someone say, try it this way. So you try it, and then you go, did that work? No, that didn't work. And I'll ask the patient, so you tell me which one you liked better. Like you said, we get them involved. Tell me, and then I'll try a bunch of different ways and say, which one did you like the best? Let's do it that way. Which one did you think challenged you the most? Yeah, and so then it's just a fun, and for them, they like coming to therapy more, and it's everybody's more motivated. So
yeah, as you said, you love the activator poll. It's also my first time to learn that, and I asked the team, the group, have you used this, the activator poll? Majority of them have experience using it.
Yeah,
and then it's my first. Yeah, it's my first time. I said to Mandy, it's my first time to hear about that because she's based in Canada. So we're trying to learn more about it. And then she said that she will going to do it more in this to our group. And also the balance vest, the balance disorders.
Yep.
So I approached Cindy, and then I said, this is new to us, although I see some, but not everybody are certified or knows how to do it, use it. So the good thing is we exposing, so learning different tools, skills. So how about you, Jay? Tell us more about the Neuro Spark. So at least you can make an impact to us.
So for a long time, I've wanted to have more opportunity. Like I feel like during my progression, I didn't really have a mentor or mentors. Like I just kind of plowed through on my own. Like, I never thought I would teach in a million years. It's just like if someone offered me an opportunity, I was like, sure, I'll try it. Like, I don't know how to do that, but and it was a topic I loved, and I know how to work hard. And so, I've kind of plowed through, and I wanted to work more closely with facilities. Like if I did a course, I did this once, a course on Sunday, then I stayed Monday in Indiana, and then I worked with a therapist, and I loved that opportunity to be able to connect more. Well, I was approached by Erin Gerardo and Claire McLean in California, and they had started Neuro Collaborative, so Facebook page, and they have neurocollaborative.com, and they started that, and they said, we kind of want a different branch, one that's about mentoring therapists. She goes, we want to mentor them about starting practices, private practices or wellness communities or whatever. And so I was like, just as usual, I was like, I don't do online well. Like I just got a Facebook page, and I'm just doing a group. Like I don't even have friends because I don't want it. I just want to do the groups. And so I'm not good with that kind of technology. And they said, no, we take care of all that, and you'll do your thing. And so essentially it's a membership, and we just opened up our second round. And so in October, I think we open up it again, but we have like about 140 members, and we give them continuing ed. So I do like an hour webinar twice a month. We're going to do a live course, hopefully in September. Wow. I post different things, and we have different discussions, and we do cases. So therapists actually bring and can submit their cases on certain Treatment Tuesdays and can submit their case, and I'll look at their case, and then I'll go through what I would do with them. Or once someone still had the patient, so we were emailing back and forth. I was giving her ideas, and she was trying them and videoing. We have releases, and she's getting videos of the patient. So we saw her patient before. I told them my ideas, and she tried them out. And then we were able to show what happened, which ones worked, which didn't, and maybe why, and what else we would do. And then we got ideas from the group. And
that's awesome.
It's just been this really exciting for me because, again, I've met done some one-on-one consulting, and some amazing therapists who are just giving me great ideas. And did you know about Mary Mastery's course? And I was like, no, I want to take Mary Mastery's course. So, just amazing stuff. So it's been really exciting. I'm very grateful for the I call them my brilliant ladies in California. That's what I call them. That's what I say to my husband, the brilliant ladies in California.
And they're a group of ladies in California.
Claire and Erin. Yeah, it's Claire and Erin. And they just were very forward thinking. I mean, they're younger than me and they're just like you, like putting forward thinking, putting together things that no one else has done before. And when we have this amazing platform, I mean, it's an exciting time. I know it's a rough time right now, and I don't mean to dismiss that, but it's also, there's an exciting time of opportunity of ways that we can connect even more. So it's just, I'm very grateful to them. Yeah.
Yes. Congratulations. Yeah. Tell us more later. At least when it's all out, just let us know. You can send us more information and we can inform the group, so we can be more involved about it.
Yeah, and just to let people know, just because I have a few free webinars, there's no CEUs attached, but if you go to neurocollaborative.com, it has free webinars. And I did a extensor thrust one for gait, and I did an upper extremity for spinal cord and stroke. But because they're free, and if that's an area that you work with, or you want a little, I give a little tidbits, but just throwing it out there.
Yeah, especially when I asked Paul, what are the days that you really be more interested listening to our skilled therapists, and they're saying Fridays at this time. So I will just ask, I will going to ask some of our clinicians and then academicians to do let's say 10 to 20 minutes of their own, so there will be a live, because there's a question and answer, like with a webinar, let's say it's pre-recorded. Sometimes they want to ask the speaker itself, but it's only recorded. So I just want to have also a question and answer in the future. At least we ask what they wanted, what they're looking forward, things like that. So thank you so much, JJ. So you're really amazing. I always watch. You're in MedBridge, your courses. Yeah. Now you have the Neurocollaborative group, and we will check it out. So how can we connect with you? Tell us more.
So I'm not easy. I'm not hard. I could say I'm not easy. I'm not hard to find. You can find me.
You're not easy.
Yeah, when you search me, I seem to come up. I think that's a MedBridge thing. And I've just redone, or I'm finishing up 3 courses. I'm redoing my balance course for them. So hopefully in August I can read, because it's going to be good. I'm excited about it. So, yeah, they've been very kind to me. My reactive balance course is on MedBridge. And I do have a promo code that people can get $50 off.
Oh, yeah, please.
So I'm always, but it's just, you get $50 off if you do a subscription if you haven't before. So it's just my last name, Mowder, and Mowder in all caps, and then small Tinney, Tinney, capital PT. So Mowder-Tinney PT.
And then we will put on the code. So
that's the promo code.
For the whole subscription,
off.
Right?
For the year subscription off.
Yes.
So just anytime you can save some money, I'd like to throw that out there.
Yeah, I will put that as well.
But you can email me at jjmowder@gmail.com. That's a pretty safe place. But if you were to search me, you'd probably find me.
Thank you. Thank you. So let's say I'm sure our clients and caregivers are also listening right now. So if they have issues with their balance, and of course they keep falling, what's a quick or frequent tips that you always tell them? So they're listening.
You know what I'm going to say, because they got to go to their PT. I mean, I know that sounds like a cop-out, but they'll say, well, I'm too good to be at a PT. But you want to find the PT who has their GCS and their CEEAA. You want, especially the CEEAA, I think, you want to know that someone is going to do your balance assessment and really retrain your reactive balance so that you can do quick stepping, and so that when a situation comes up that you're not prepared for, and you're not falling. So you want to do prevention. There's great research on prevention of falls, but not everyone is trained in those things. So you want to call and ask, do you work with, this is a prevention thing. It's really, really important. And I feel like, yes, always moving is always good. Right. But really specifically to be able to challenge you to the way that you need to be challenged. I need a gait belt. I need to challenge you so that I can force you to take those steps and retrain that. I mean, we know what strengthening can do.
Yes.
So, and we know from this research what retraining some of reactive balance. And so if you were to call a therapist and say, do you work with people, within this age range, have experience maybe with people within this age range, and work on different reactive balance strategies. Be explicit about what it is you want. You're not just going to go there and they're going to say, oh, well, you walk pretty well at 0.9 meters per second. Well, no, they could be walking at 1.3. They could be 1.2. They could be walking, at a better speed, but you need to recognize, and then you just hang up and it's okay. Call the next place that's nearby. But you scope it out and you ask specifically, and you go in and you kind of not demand, but but this is what I want to focus on. This is what I want to see. And this is what, I want to get better. And so, and there's the great work by Pai. He does the 24 slips, the inoculation of falls. He's the one who's got me completely addicted to this whole reactive balance, because it shows you that 24 slips in one session can help prevent falls. So if there's one article, it's just called Inoculation of Falls. I'm pretty sure there might be a little bit more to that title, but Pai or BOT, BHATT, they do a ton of research in that area. And if I never thought of this before, but just talking to you, if they would read an article like that and see something like that could help, and take it to their therapist and go, what about this kind of work? Because there's just a ton out there. It's just that you have to be looking for it a little bit.
I like that point, the reactive. So we'll try, you say Pi. I am not familiar with that too.
PAI, yeah, and I have these links.
Yes. So once we post it, guys, we can also put all the links, or those like the Neuro Collaborative group, and also the links for this new articles or new courses, where we can check these things. And I super agree with that. Check and demand, because that's where they're going to work with, I want that also, that we as a clinician try to progress ourselves. We don't want to be like status quo. Okay, I've graduated, I'm done.
Yep.
Keep challenge yourself, because that's what I wanted, is that I want to learn more, because once I have a better knowledge, I can apply this to my clients. And once you made them improve, you made an impact, it's a big difference. You can always get back home. Oh, all right, I was able to do Miss Smith, and I just knew the technique the other day. Something like that, right?
Yeah. Well, that's what you do on your web. I mean, that's what I like. You do on the Facebook. I mean, you're trying to provide places where you can't say, oh, I don't know where to go next, or I don't have anywhere else to go. I mean, you're handing them things to go look at, and you pick the one that makes sense to you and that you can feel passionate about, because that's key. But I think that you're absolutely right. We have to continue with that. And I'll just email you, just from a quick standpoint, just a couple links for some of that work, and you can decide what to post.
Thank you so much. Thank you so much. And especially, we are a group of clinicians. We have caregivers. I believe our balance and fall support groups are more or less 75 to 80% clinicians. And then we also have clients and caregivers. We ask them to go to their clients. Let's say we have in specific state. So you're in New York. So, okay, go to your clients, and then I will refer to this. And then we have different Parkinson's experts in different state. We have Texas. We have different GCS or geriatric clinical specialists in each state. So if they're doing telehealth. So if we have specific clients having question, and they said, oh, I'm from here. So we remember, let's say one of our colleagues will be there. So, and we refer to them, and we have lots of mentors and academicians. You talk about the certified exercise expert in aging adults. We have everybody here. We even have our speaker, Dr. Dr. Jill. And so
she's awesome.
Yeah, she's really very easy to approach, and she loves to educate us clinicians. So we really appreciate everybody in the group. So thank you so much. You just like you just offered your time to us, because everybody will be listening, and I'm sure everything that you share to us, we learn more right just now, and it improves us to be a better clinicians, So we appreciate that. So
thank you so much for having me on. It was great.
My pleasure.
Nice
My pleasure. You too. So any other closing remarks?
No, I think you have it covered. You don't want to get me started again. You don't want to get me started
yeah,
again. So I'm good.
Thank you so much. And we will try to connect with you, JJ. We appreciate you.
Thank
So
you.
you're welcome. So guys, that's Dr. JJ Mowder-Tinney. So we knew lots of things about her. We have a MedBridge discount code for her courses in MedBridge. She will have a New Balance reactive courses there coming. And also she is part of the Neuro Collaborative group. And then let's connect with her. So it's me again, Dr. Jenny, you're a physical therapist and Dr. Physical Therapy, board certified clinical specialist in geriatrics and certified expert in aging adults. So just try to connect with us. If you have any questions, we have many clinicians and academicians in the group. All right. Thank you so much. Bye, guys. Have a great day.
Thank you.
Thanks, Jay.